welcome back to my channel. I'm Mira, this nurse Mira. To my new subscribers, hey, how y'all doing? Welcome to the channel. To my oldies but goodies, welcome back. Y'all, I know I've been talking a lot about everything other than nursing, so it's time to get back to the nursing per se. But what I wanted to come on here and I wanted to ask y'all about this. Y'all know my new job. Y'all know what I do. I really have no issues, to be honest, with my new job. Normally, when I got the job, I was told, you know, I would be doing assessments, mainly assessing the patients and documenting on the patients or whatever, making sure they remain safe. And, you know, I do more, okay, I work in a psych facility now, but I'm normally more so, my whole career, I've been more so on the medical side as far as healthcare. I know mental health is healthcare, but I've been more so on the medical side of healthcare. And working where I work now, it's more so on the psychiatric side of healthcare. And y'all, I'm not gonna say I have a hard time differentiating between mental and medical, but I notice things in patients when they start behaving a different type of way, differently than what they were when I started working there in January. And y'all, a lot of the differences they say these patients are exhibiting, they're attributing a lot of the differences to psychiatric issues. But so many of the symptoms that they're exhibiting, it looks medical to me. And I don't know, I have a hard time just accepting a lot of the things are psychiatric. Like, I don't know how to describe it. Okay, so if a person has, so I'm so used to geriatrics that if a person has a sudden change in their behavior, their care, the way they go about doing things, their mood and all of that, I'm the first one to say, oh, this person needs to have a UACNS, because the way they're behaving, they're not acting the same as they were acting in January. And when I started working there in January, I mean, the patients consistently behaved a certain way from January all the way up until I say like mid-March. And then mid-March, they started acting strange. And a lot of things that happen is, some of the things that they do is they'll throw more psychiatric medication at them, as well as order like a UACNS. Now they do order UACNS. They'll order psychiatric meds before they even get the results of the UACNS. I have a hard time reconciling why they would do that until you actually get the results from the UACNS. Elderly patients are prone to UTIs. We already know that. Females are prone to UTIs, and elderly patients are prone to UTIs. This person may be behaving like this because they have a UTI, especially if they have UTIs in their history, like frequent UTIs or whatever. And it just breaks my heart to see, because I'm the medication nurse. You might as well say I do medication when I work there. And y'all, let me tell y'all, that's really the easiest job. I'm not gonna lie to y'all. I be going in sometimes and I be like, oh, I don't feel like passing medicine. But the amount of downtime I have when I'm the medication nurse, when I'm in that medication room, being that I work day shift, and day shift has like the heaviest med pass of all, they don't really bother me to come do anything really out on the floor with the patients. I do treatments as well. So we do have, we do have patients who do little things like pick their fingernails and pick this and pick that, and so we have to do little minor treatments on them. No one has any gaping wounds or anything like that. They'll do something like every now and then fall to the floor, scrape their knees, something like that. But I do the little minor treatments on them, and I do administer the medication. And I think I got that paper, y'all. Let me show y'all that. Let me show y'all the paper if I have it in here, where I said I was so efficient at passing the medication. I'm reaching around for the paper, y'all. I can't find it in this bag. Anyway, so yeah, I'm trying to, and then I tell, oh here, no, that's not it. I tell the other nurses, is, you know, well, let so-and-so know that so-and-so is behaving a certain type of way or whatever. But it's like the nurses that are doing the assessments, maybe because I'm the medication nurse, and so with the patients coming up and speaking to me and talking to me at the window, because when I pass their mask, I greet everybody. I'll be like, hey, how y'all doing today? Hey, how you doing today? How was your breakfast? Hey, how you doing? How was your lunch? Oh, you know, I talk to my patients like that. And I notice little changes in them. And I think when you're an assessment nurse, most of the time the assessment nurse, what they do is they'll just walk around the atrium like every hour, every other hour. They alternate. One nurse to do 1 hour, the other nurse to do the next hour. If it's only one nurse, they try to walk one every hour, but they hardly ever do it. I've seen one nurse come in and do assessment and didn't even walk the atrium, period. I don't know how they was assessing. I guess just sitting, because there's an open window and you can see around the whole lodge, except for when they're in the pods, when the patients are in the pods. But they didn't even make one round. I don't know, but, and that wasn't a nurse that works the lodge, that's assigned to the lodge. That was a nurse that got transferred there from another lodge. Well, I actually walked the lodge, and I talked to the patients when I walked the lodge. Even when I walked the lodge, a few times that I am an assessment nurse, I walked the lodge and I actually talked to the patients because I just like to talk to my patients. And so, yeah, but I noticed little changes in their behaviors, and y'all, like a patient can have a change the first week of March. They won't even address it until the first week of April, y'all. I don't understand. Something I forgot to tell y'all is I had a finger stick, an accidental finger stick the other day. While I was working, we ran out of the, not retractable needles, but they're the insulin pens where you can lift the little thing up once you finish giving the insulin, so it covers the needle. I ran out of those, and I didn't see any more of those, but they did have the little, I call them old-fashioned needles, the little ones that just have the little needle, but they don't have anything to cover the needle after you do. Give them the insulin, and I was giving a patient insulin, and when I withdrew the needle, I accidentally stuck my thumb. Now, I did milk it. You know, you milk, after you do a finger stick, milk your finger to get the blood out or whatever. And then I washed my hands and put a band-aid on. I did do all the precautions of reporting the finger stick and all that. And I looked at the patient's history. I don't want to get too much, but anyway, I looked up the patient's history, and the patient didn't have any history of anything bloodborne. But anyway, I still reported it. My mind was telling me, girl, report this, report it. My mind was telling me to report it, y'all. And so I reported it, and I didn't go to medical because I didn't see anything in the patient's history. So I didn't go to medical or anything, but I did report it, did the paperwork and all. Child, why the person came back reactive to hepatitis C. I don't know what is that, like the antigen react. I don't know, but the patient did come back reactive. So y'all, I'm dealing with that right now, because I'm new to working to the state, so I didn't know there was at one point a protocol. One of the nurses, she wasn't working that day. The nurse who basically told me to come work there, she wasn't working that day, but she's a nurse that worked many years for the state. So when she came back, and you know, she told me that happened to her before. They're supposed to start you immediately on Cipro. They're supposed to immediately start you on Cipro, whatever. Now the patient that I accidentally stuck my, you know, the patient I was administering an insulin to, of course, blood work was ordered or whatever. But, you know, and it came back that the patient was reactive to Hep C or something, like whatever along the lines of that. But they're going to redraw because that wasn't a diagnosis that the patient had. So, yeah, I got to go through all kind of whatever now behind that. But they didn't immediately start me on any antibiotics, y'all. And so I asked my supervisor, I was like, well, I was told that I was supposed to immediately get started on, you know, an antibiotic and this and this and this and the third. And she was like, well, that was the old policy. That was not the new policy. She was like, but if you want to go to medical, if you want to get blood work done, then, you know, and I was like, yeah, I want to get blood work done, y'all. So I'll let y'all know how that goes. I'm not worrying about it per se, but it do be on the back of my mind sometimes, but I'm not really worrying about it. But it do be on the back of my mind, y'all. I feel like they need to initiate that policy again, because I didn't know know that was the policy. I had never been through anything like that with getting an accidental finger stick, so I didn't know what the policy. And that's why you should read your policy and procedures, because I would have known if that was or wasn't a policy. But I'm going to have blood work done on myself because of the accidental finger stick, y'all. So I would keep y'all updated on how that goes, how that turns out. I always thought state-run and federally run facilities, government-run facilities, that the patients were treated better because it was a state-run or federally run facility. But from working in this state facility, I have come to realize that is not true. That is not true at all. I honestly feel like patients that are in private facilities, privately owned facilities, are treated better than patients in state-run facilities. Now, I've only worked in this one state-run facility now, so I can't base it all on all of them. But I feel like the care and concern that is given to patients in long-term care, even though some of y'all feel like the patients are not treated right, and this and that, I feel like the treatment that patients get in long-term care is better than the treatment that the patients are getting in state-run facilities. And I think it's due to the fact that a lot of the workers in state-run facilities, like caregivers, do not have to be certified in some of the ways I hear the workers talk to the patients, and I'll be like, yeah, they do have a mental issue, but do you realize they have a mental issue? Like, you talking to them like they're cognitive and can have this conversation with you. Like, it's almost making me think, is something wrong with you? That, are you expecting reason? Are you expecting reason? Are you expecting this patient to respond to you appropriately and reasonable? And they're a patient in this facility. So some of the patients, y'all know I have an autistic child, and autism is considered a mental disorder, basically. But you cannot treat a patient who has autism, in my opinion, the same way you treat a schizophrenic. That's my opinion. You cannot treat a patient who has delusions and hallucinations the same way you would treat a patient who has a manic depressive, or what I'm saying. If y'all understand what I'm saying, like, you gotta you treat them all with respect, but I don't know how to explain it, y'all. I don't know how to explain it. So this is just a short little video. I just want to tell y'all about that while I head to this place. I'm probably not going to show the mobile homes in this video. I'm probably going to do another video, because this video here has gotten so long for me just talking. So, or maybe I'll edit it so short that I can throw the mobile homes in this video as well. But if I'm ending this one here, then y'all, thank y'all for watching. Thank y'all for listening to me ramble. Y'all, the way I ramble here on this video is the way I think, and I need to do better, y'all. I need to do better, because it don't make no sense to sit here and have all these thoughts. Yeah, anyway, thank y'all for watching. Either the next clip is going to be me showing y'all a mobile home, or I will put the mobile homes in the next video, and I'll be signing out for this one. Hey y'all, so if y'all can see, I'm leaving the mobile home lot. I didn't even record because their prices are just it's no comparison to the place that I went. Y'all know at the place that I went, I found a double wide that included setup and everything for $110, one for even $123, and they were both nice. They don't even have a double wide here for anything close to that price. They only have a single wide, and the single wide, now don't get me wrong, the single wide is beautiful, but the size of the bedrooms in single wides are extremely small. I have a king size bed. I want a little bit more space than what a single wide can offer. Now, for my daughter, that single wide would be perfect. But I feel like if I'm at the other mobile home park, if I found a double wide for 110, I'm pretty sure she could find a single wide that's just as beautiful for like 70 or 80, you know. Y'all know I was saying I would purchase a second trailer, right? So if I couldn't get 2 double wides, which I'm pretty sure if I sell my home, I know I could get 2 double wides. But if I couldn't get 2 double wides, I would probably co-sign for a single wide for my daughter later on in life, and then, you know, something that I know I could possibly afford, especially once I pay down my current mortgage or sell my current mortgage. There's no way I'm going to pay 110 for a single wide, even though it's built better. There are wind zone 3 mobile homes here, and if you know anything, wind zone 3 is like the best wind zone. They could withstand the higher amounts of wind. They're sheetrock, they're, you know, oh, I put my seatbelt on. They're built better, but I'm not about to pay that. I'm not about to pay that. So I just looked at the single wide just to look. I almost just to look. I'm not paying that for a single wide when I can get that same price for a double wide. And the double wide was, you know, the 110 double wide that I saw is pretty basic. Now, don't get me wrong, it don't have all the bells and whistles, but it still has much more space than that single wide, and that bedroom wouldn't even work for me. And then the double wide I saw for 110 was a 4-bedroom. So I called this other company because I feel like I just wasted my gas driving up here, even though it was only like 30 minutes away from where I was. So before I waste my gas going to the other place, I called them, just asked them a couple questions. They're going to call me back, because if it's not even worth going to them, I'm just going to go, you know, I'm just going to stick with the company I went to, where the double wide was 110 and 123. Yeah. I still just feel like that is so expensive. That is so expensive. Maybe by the time I'm actually ready to purchase and put the money down, I can, the price will drop maybe by another $10,000. 110 is so expensive for a trailer, y'all. I was talking to my niece this morning, and when I was telling her the prices of these trailers, she was looking at me like I was crazy. And she was like, "You don't think you get a trailer for $40,000? And I told her, honestly, it would have to be a used one. I'm not opposed to getting a used trailer, y'all, but it would definitely have to be a used one for $40,000. I'm not getting a brand new trailer anywhere for $40,000. Which is so sad, because just 5 years ago, double wides were running like $60,000, y'all. You could find a nice double wide 5 years ago for like 65 or 70. These prices are ridiculous. I hate to say it, and I shouldn't say this because it could affect me, but y'all, I'm almost ready for the recession, because inflation is not it at all, and these prices on everything it's just too much. It's too much. I was at work looking at land online last night, y'all, and I saw this property. It was the house didn't even matter to me. I was looking at the land. It was $1,800,500. It was for 192 acres, and it had a home sitting on the property. And when I did the math, I think I came up with it was less than $10,000 an acre, which is ideal right now. Y'all remember when you could buy an acre of land for like $2,500, $5,000? I remember those days, y'all. I remember those days. And now, like the guy in there, he told me he had land in the area that I was looking to move to, a half an acre for $50,000. He had two half acres together. He was like, if you buy both, he'll give me a deal. Sir, I'm not trying to spend $50,000 on a half an acre of land. I'm not even trying to spend $50,000 on an acre of land. Somewhere. And mind y'all, I have heirs property. Like, my family has land. But you know, when it's family land, it's all kind of mess you gotta go through. And I don't feel like going through all that with my family, asking this person and that person to move on the land. Like, I don't got time for that. I'm gonna buy my own land, me and my family. If I can only get me 2 acres, I'm gonna buy 2 acres. 2 acres of land is a lot, y'all. I'll go buy me 2 acres, but somewhere, somebody gonna let me get an acre of land for $10,000. I wish I can get it for $5,000. But somebody gonna let me get, and I was telling him, I was like, yeah, I am not nowhere near prepared to pay anywhere close to $50,000, not even for an acre of land. I said, I understand, maybe it's, you know, my fault in my thinking, the way that I'm thinking, but I'm just not paying that for an acre of land. I said, I got time. I'm looking to purchase some land by this summer. I'm gonna find an acre of land for $10,000. And he was like, you know, it could happen. Yeah, it's gonna happen. Because I was even looking at some land last night, and like the people are selling it in, like, it's ridiculous. But if I could find one to say where they're selling like 10 acres for $100,000, if I could talk them into letting me purchase just 1 acre, you know, just let me get 1 acre of that. I just want 1 acre of that. I just need my 1 acre to be accessible to the road, you know, and I'll be fine with that. You know, I don't want anything landlocked now. I don't want anything landlocked, and I need some land that's gonna perk. But yeah, I just need 1 acre of that. All the acres you got, that's all I need. I don't know how people out here paying all this money for this land. Y'all, I don't know who do. Y'all must be, it gotta be millennials. I'm sorry, because ain't no Gen X paying $50,000 for no acre of land unless they multi-millionaires, and I can't even see it then. I'm not. So, you know, I'm hoping all this is not just a pipe dream, but I've heard, like, I have co-workers who went to auctions and got an acre of land for $1,000. Oh, yeah, y'all. So this will probably officially end this video. I just want to give y'all an update on that mobile home park. I went and looked at one trailer, and that really was just to humor him, which I really wasted my time because I know I wasn't going to get that single wide. But I just wanted to look because it's so beautiful. It just wouldn't work for me. It wouldn't work for me because it just won't work for me, y'all. So anyway, I'll see y'all on the next video. Bye.